This proposal is about the medical home that brings that care together in one place, in one coordinated sense that looks after that patient. Not just in primary care, we'll be asking the states to partner with us so when they go into hospital and come back out, they're not discharged to a vacuum or to another whole group of care professionals who aren't familiar with their particular needs. This is really exciting. I've got to say that every single doctor I've spoken to since becoming Health Minister has emphasised the importance of the GP medical home model.
And talking about the doctors that you have spoken to, now how will they be paid the rebates, given that this is going to change the way that they also treat their patients?
Existing streams of revenue that come to them through practice incentive payments and team care plans and other arrangements separate from the Medicare rebate will be rolled up and distributed in a different way. I must say a simpler, more streamlined way for those doctors, and they will effectively look after that group of patients and be their medical home.
So how do patients sort of pick one doctor or one GP as the home base? It could potentially create competition for a particular doctor, could it not? Or would there be actual centres?
In the same way they pick their doctor now, in the same way they find someone they can trust in their area who understands them, it's no different from that. But importantly, that individualised care will engage them to take an interest in what happens to them, perhaps more than some of them do, particularly when they see 5 different GPs and get quite a bit of confusing advice. We know that if you live with a chronic condition, like for example type 2 diabetes, the more that you can be engaged in looking after yourself, doing the right diet and exercise, seeing your dietitian regularly, and just being part of of your own health, the better you will be over time. And this model mobilises you as well as your doctors.
Minister Ley, the cost of healthcare is going to increase over the years, particularly with the increase in chronic illnesses, which is what this package is related to. One of the big issues at the moment is, of course, the funding for the state hospitals. Now, the government's proposal on allowing states to set their own income tax is being met with some opposition from the premiers. Is there a plan B as you head into COAG tomorrow?
Well, the income tax raising by the states is part of a conversation that will be initiated by the Prime Minister with the Premiers. It's not expected to land at COAG tomorrow, but I do think it's an important discussion, certainly in the health field, to have states continually ask for additional funding. We need states to be accountable to their own populations for the requests that they make. But this, as I said, is about long-term structural reform of the Federation, and I know it'll be a really good conversation. In the shorter term, we are negotiating a new health agreement with the states. I know it's a good one. The Prime Minister has a really good deal to offer to the states, and more importantly, it's in the best interests of patients, and more importantly, it will include this chronic complex care out of hospital. We've got about half of all hospital readmissions could be avoidable if there was proper care in primary care as you go in and out of hospital. And that's good for both state and Commonwealth budgets, but more importantly, it's really good for the patients.
But Minister Ley, in terms of this long-term structural healthcare reform, if the states are allowed to set their own income tax rates beyond 2020, as you've mentioned already, with the ballooning healthcare costs, essentially what we're looking at is higher income tax rates and different income tax rates in the different states. So doesn't it just come down to double taxation?
Not at all. And by the way, there are different payroll tax regimes in different states, and what happens in the tax system will continue to be behind the scenes. The ATO will manage it all. But overall, this is not about more tax. This is never about more tax. It's about less tax. And I know that a better health system is not necessarily about more money. It is, as I've described, about keeping people out of hospital, which costs less. But there are huge inefficiencies in the health system. And we know if we get those right, we won't have ballooning costs of healthcare. We'll have them managed and we'll have better patient care overall.
There are some people that are saying this is just a distraction from the $80 billion cuts from Tony Abbott's first budget. How do you respond to that?
Absolutely not. And I'm looking forward to Labor's health policy. We don't have a single Labor policy not one. Labor occasionally mentions these cuts that you just have, but in demonstrating that they are entirely unfunded, they were just a spending promise into the distance. They have never suggested that they're going to put any of them back. But we know that if we get the balance right between primary care, between Commonwealth and state funding, if we address the inefficiencies that happen now, and if we use activity-based funding and the national efficient price and better safety and quality for patients, we'll have the best possible system. We'll end the blame game with the states. And I always bring it back to patients. That's who we build the system for. We need to look after patients. Today's announcement is all about the patient.
Well, the Greens have come up with a different plan of their own in terms of private health insurance at least. They're saying that you should just dump the private health rebates that are currently in place. It could save the government a lot of money. How do you respond to that?
Not at all. By encouraging people to invest in the cost of their own health in a private hospital, we take pressure off the public hospital system. We've always understood that very well, and people do, they make great sacrifices to pay for private health insurance cover. We have got a balanced package of reforms addressing at making private health insurance more affordable and delivering value for people, because I'm hearing a strong message that they're cranky and they want to stay there investing in private health, but they want a better product. We are working on that. But overall, I come back to my point about the private and public systems. We need the public system for the vulnerable and disadvantaged, and we need a strong private system as well.
And last question, Sussan Ley. There have been some mixed messages from the government. There seems to be a bit of a communication gap between the Prime Minister and the Treasurer Scott Morrison over the income tax proposal, but also, of course, with the change of the budget date. How are things between the two? Are the communications line clear and open?
Well, from where I sit, they're very clear and open, and these issues are discussed in Cabinet. They're not revealed after those in-house Cabinet discussions, but members of Cabinet have been part of them all the way along, and what you might perceive in the media is purely your commentary and your speculation.
Well, we had very different commentary from the both of them yesterday, which is why I put that question to you.
Well, all I can say is what I see, which is a very convivial relationship between everyone around the Cabinet table. Intense discussion about the things that matter for the future of this country. And again, I'm delighted that our announcement about primary care is about better health for patients across Australia.